The SARS-CoV-2 virus causes coronavirus illness, an infectious disease. The majority of those infected with the virus will have mild to moderate respiratory symptoms and will recover without the need for medical attention. Some, on the other hand, will get critically unwell and require medical assistance. Serious sickness is more likely to strike the elderly and those with underlying medical disorders such as cardiovascular disease, diabetes, chronic respiratory disease, or cancer. COVID-19 may make anyone sick and cause them to get very ill or die at any age. The best way to prevent and slow down transmissions is to be well informed about the disease and how the virus spreads. Protect yourself and others from infection by staying at least 1 meter apart from others, wearing a properly fitted mask, and washing your hands or using an alcohol-based rub frequently. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, sing, speak, or breathe. These particles range from larger respiratory droplets to smaller aerosols. It is important to practice respiratory etiquette. For example, by coughing into a flexed elbow, and to stay home and self-isolate until you recover if you feel unwell. The virus can also spread in cramped and or poorly ventilated indoor environments where people spend extended period of time. Because aerosols can float in the air or travel beyond a conversational distance, people can get the virus by touching their eyes, nose, or mouth after coming into contact with contaminated surfaces or things. Get vaccinated when it's your turn and follow local guidance. Vaccines include weakened or inactive components of a certain organism or antigen that cause the body to respond with an immune response. Rather of the antigen itself, newer vaccinations contain the blueprint of generating antigens. This weakened version will not cause disease in the person receiving the vaccine, regardless of whether the vaccine is made up of the antigen itself or the blueprint for the body to produce the antigen. But it will prompt the immune system to respond much like it would on its first reaction on the actual pathogen. Coronavirus mutation. What causes coronavirus mutations? Viruses become variants when their genes alter or mutation in some way. It's in the nature of RNA viruses like the coronavirus to develop and alter over time, according to Ray. Genetically different variations likely to develop from geographic isolations, he explains. Virus mutations, such as the coronavirus that caused the COVID-19 pandemic, are nothing new or unexpected. All RNA viruses change over time, some more than others. Bollinger notes. Flu viruses, for example, mutate often, which is why physicians suggest getting a new flu vaccination every year. What exactly is a Delta variant? The SARS-CoV-2 coronavirus that causes COVID-19 has mutated since the start of the epidemic, resulting in distinct various types. One of them is referred to as the Delta version. The WHO and CDC have designated the Delta virus as a variant of concern, which it appears to be more easily transferred from one person to another. Delta is now the most contagious type of the SARS-CoV-2 coronavirus as of September 2021. What is a worry variant? Organizations like the World Health Organization and Centers for Disease Control and Prevention divide coronavirus variants into different categories. A variant of interest possesses genetic traits that suggest increased transmissibility, invasion of immunization or diagnostic tests, or more severe illness when compared to previous versions of the virus. A variant of concern has been shown to be more infectious, causing outbreaks or reinfection in those who have been vaccinated or sick previously. These variations are more likely to induce severe illness, elude detection, and resist antiviral therapy. The SARS-CoV-2 coronavirus alpha, beta, gamma, and delta variations are classed as variants of concern.